The following program is sponsored by the Medicine Center Pharmacies.
We'd like to remind our listeners our program is also available on our podcast. You can search your favorite podcast app for Health Matters with the Medicine Center Pharmacy. Listen to our program anytime.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsors, Cleveland Clinic Mercy Hospital, Studio Arts and Glass, Jen Orr Appraisals and Liquidations, and of course, our socially distant technical producer, J.D. DeAngelis. Today, Brad and I are broadcasting from our administrative offices, and our guest is Chris Fankhouser. Do I have that right, ma'am?
Yes, you do.
Okay. DPT, Executive Director of Hospice Services at Cleveland Clinic Mercy Hospital. It is both National Hospice and Palliative Care Month and National Caregiver Month. We wish to express our admiration and gratitude for all the caregivers listening to this show today. Good morning, Chris, and welcome to the show.
Good morning, and thank you for having me.
Hospice care is not just a place to go to die. Across the United States, over 5,500 hospices provide medical services for pain management, lend emotional support, and offer spiritual resources and therapies as patients enter their last stages of life. Some interesting facts about hospice care. Cancer is the largest category for hospice diagnoses, accounting for 37% of patients. Over 65% of patients' pain was brought to a comfortable level within 48 hours of admission and assessment. Over 70% of families would rate their hospice care for their loved ones as excellent. While hospice care is being used more often, many families wish they had placed their loved one in the care of a provider sooner so their loved one could have been more comfortable during their last days. Over 60% of patients only received care for 29 days. Please join us this morning as we honor and celebrate those tireless workers who provide an invaluable service and make a difference every day in the lives of patients and families they serve. This morning, we're going to talk with Chris to learn more about these services and how you can receive care when it's needed most.
So, Chris, tell us a little bit about yourself and your background.
Sure, Paul, thanks. Again, my name is Chris, and I'm actually a physical therapist by trade. I went into the field of physical therapy several years ago. I knew that I wanted to help people. Nursing and needles, I don't think were for me, as I passed out every time I saw a needle at the time. So I went down the route of rehab and, have thoroughly enjoyed it. A couple years ago, came into this role here as the executive director for Mercy Hospice, and I absolutely love it. Absolutely love it. I've spent, the majority of my 20-some-year career in long-term care working with the elderly, and it's a wonderful field.
So what's your role at Mercy Hospice?
I'm the executive director here at Mercy Hospice.
So you must have many folks under your tutelage. Is that correct?
I do, yes. Our entire team all a huge team, but yes, I am the direct report for everybody.
Some may think working with hospice care might be extremely difficult. So you said a little bit, but what drew you to this field?
Honestly, Paul, it's a very personal story. I think that, over the last couple of years, what I found, especially with hospice, is that everybody who is in hospice or getting into hospice has a personal story of some sort, and mine is really no different. Back in 2009, I was pregnant with my son, and my grandmother was very independent at home, just decided one day that she didn't want to go to the hospital anymore. My parents went to go visit her. My mom, being a nurse, kind of talked with her and said, "Hey, well, Mom, what do you think about hospice care?" Explained what it was. We got her admitted onto hospice care at home. Fortunately, it was a very, very fast process to get hospice involved. Unfortunately, Grandma was only with us for 5 or 6 days after we admitted her, but it was honestly the most beautiful experience that we had. She was just very at peace. She was pain-free, and it was just a wonderful time for our family. to be together and to learn more about each other and just be able to share that experience with Grandma together. And honestly, ever since then, I've been wanting to get into hospice some way, somehow, because I really just believe in the philosophy, and I believe that it's such just a huge benefit to so many people.
So some of our listeners probably don't fully understand what hospice care is. So what is hospice care?
Sure. Hospice care is actually it's a special level of care for the terminally ill people of all ages who choose to no longer elect curative care or aggressive treatment. They would rather have comfort care. In hospice, we do not really focus on the quantity. We focus on quality. We want each day, however long that person may be with us, we want each day to be all about quality and building relationships with love and respect and dignity.
Years ago, when we had an infusion company, we were dealing with hospice patients, and this was really quite a while ago. And back then, they didn't really put you into hospice care until, as you just spoke, nearly at the time when the patient dies. And I think now that it is more frequently patient is brought into hospice care earlier. Is that about right?
Yes, at times. At other times, it's all the patient and family choice. And I can only speak from my personal experience. Had we addressed hospice any earlier with my grandmother, she would not have been ready. And I don't think that we would have been ready because she wasn't. You look back at all of the signs over the past several months before we did elect to get her into the hospice care, and all the indicators were there. Hindsight is always 20/20. I'm just very grateful that we did have time with, her in hospice. And again, it's a patient and family decision. People are only ready when they're ready.
So let's talk about some of the services that Mercy Hospice provides for patients and families.
Absolutely. Hospice provides nursing care, assistance with personal care, activities of daily living, the bathing, the dressing, all of that type of thing, pain management, symptom control, medication supervision and assistance, a lot of education to all members of family and friends, ensuring that the appropriate medical equipment and supplies are in place, and last but not least, emotional and spiritual support.
Okay. That's a big list. Chris, who's typically part of the hospice team?
Brad, the core team consists of nurses, hospice aides, social workers, chaplains, physicians, medical directors, and volunteers.
Okay. So can you touch on the hospice philosophy?
Absolutely. So the hospice care was originally developed by a lady named Dame Cicely Saunders. She's actually the sole founder of what our modern hospice care is. She trained as a nurse, then as a social worker, and then later in her career, finally as a physician. She insisted that the terminally ill patients, no matter what age they were, that they would live out their final days with dignity, compassion, and respect. And I'm actually going to quote her here. You guys may have actually heard of this before, but one of the most famous quotes with her, which absolutely wraps up the true philosophy of hospice, is, "You matter because you are you, and you matter to the end of your life. We will do all we can, not only to help you die peacefully, but also to live until you die." And that is just such a true statement.
So who is hospice care appropriate for?
Hospice care is appropriate for anybody with a terminal illness that no longer wishes to receive, that curative or aggressive treatment. They want to receive the comfort care. They're choosing to focus on pain and symptom management rather than seeking that aggressive and that curative treatment.
So, Chris, who decides whether a patient should go to hospice service?
A lot of the times it's the family that kind of makes that decision, and then they contact the physician if they haven't been, at a physician's office lately. A lot of the times it's the physician that might bring it up, especially if it's somebody who is seeing their physician on a regular basis. But together, it's a family choice. Family must be in agreement, and then then if the physician must say that hospice services would be needed.
So, what about the process? How long does it take to set up hospice care after a decision has been made?
Honestly, Paul, it's up to the individual. I mean, we here at Mercy Hospice, we usually try to admit patients the same day that we receive the referral from their physician or from the family. Again, it's all about choice, though. We have some folks that don't want to sign onto hospice care until the weekend when they have family members that come out from out of town, or it really is. It's just all about the patient choice. So as soon as we receive that referral, we, pick up the phone, we call the patients and the family, and together we work out a plan.
I guess, what is the percentage of hospice patients that want to stay home, or I would assume that that's an appraisal situation, but I also would assume that they'd want to stay in their home. Is that true?
Yes and no. I would say that a lot of the patients who start out at home, they definitely do want to stay at home, yes. Some folks, are in nursing facilities or assisted living facilities and are referred to hospice, so we see them there. And all honesty, it's all about what's best for the patient and the family. We do have a lot of people also at home, and for caregiver support and for a caregiver break, we do offer respite stays where for up to 5 days, the patient can transition over to a nursing facility, say if the family is having, a medical procedure done or leaving to go out of town or something like that. But it's all about, again, it's all about what the patient and the family work together to be able to decide what the best decision is for each individual.
Okay, Chris, our first break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you ready for a change? Transfer your prescriptions to the Medicine Center Pharmacy. Hi, this is Paul White from the Medicine Center Pharmacies. Are you looking for the personal touch from your pharmacist and pharmacy staff? Do you need home delivery or custom packaging to simplify a complex medication schedule? Look no further than the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Bring in your prescription bottles, and we can transfer your prescriptions to the Medicine Center today, where wellness begins.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patients' safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care 7 days a week and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Out By store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off on Out By store in Louisville, next to the Medicine Center Pharmacy. Everyone has been tuned in to where to get their COVID vaccine. We've been proud to serve the community in this process. The Medicine Center offers many other vaccines like shingles, influenza, pneumonia, Tdap, meningitis, MMR, hepatitis A and B, and travel vaccines. Do you need a vaccine? Give us a call at the pharmacy or visit our website at medshoprx.com to schedule your appointment. Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
We'd like to remind our listeners our program is also available on our podcast. You can search your favorite podcast app for Health Matters with the Medicine Center Pharmacy. Listen to our program anytime.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Flu vaccine, along with Moderna and Janssen COVID vaccine, are available. Boosters also, as I understand. And please stop by any of our stores to get vaccinated. No appointment is necessary. So, Chris, what type of changes do loved ones have to make in the home setting for a hospice patient?
Honestly, Paul, it's very individualized. If any medical equipment is needed, such as a bed, chair, oxygen, those types of things, we deliver all of that and we make arrangements to have it there. I would say very minimal changes to the actual home as far as setting things up, maybe moving a few pieces of furniture around. And, we encourage all of our families to really participate in the loved one's care. I know at least with my personal experience, my entire family stayed at my grandmother's house the entire time that she was on hospice services. So the changes that we made to that house were air mattresses everywhere so we could sleep. And, we made it work for us. So honestly, it's up to each family.
Interesting. So special equipment, if it's needed, is there someone who helps with that, navigate purchases or rentals or that sort of thing?
Absolutely. Any of the equipment that is needed to help care for the patient is included underneath the Hospice Benefit. So the equipment that doesn't need to be, rented or paid for or anything by the family. And our team of nurses and aides, along with the chaplains and social workers, as they regularly make the visits with the patient and the family, they work together during the entire time to see what type of equipment would be necessary at that given time. What's needed in the first week may be a little bit different than what's needed in weeks 3 or 4 and so on and so forth. So it's continually changing, and we just go ahead and place the orders for drop-off and pickup or exchange of different equipment and see what works best for the family and the patient.
Okay, Chris, how often is hospice care received?
At the beginning, Brad, at the beginning, I would say a little bit of everybody comes out for the first week or so. At the beginning of the journey, there are several visits by every team discipline setting up their plan of care. And based on what the family and the patient needs and what they want, that's the number of nursing and hospice aid visits, social worker visits, chaplain visits are then kind of determined together. As we kind of go out through the entire journey, a lot of the times the overall visits are not needed as frequently, but then as the patient does approach end of life or as symptoms change, the number of visits will increase. So it's kind of an ebb and flow type, situation, and it all depends on what the patient and the family needs and wants.
So what if the patient's condition improves? Can the patient go on and off of hospice care as needed?
Oh, absolutely. The need for hospice is continually reevaluated on a regular basis by our team, which includes our physicians. And the patient and the family, if they decide they would like to go off hospice and seek aggressive treatment either outside of the hospital or in the hospital, they absolutely can do that. If after that treatment or if they change their mind and they want to come back onto hospice, as long as there's a physician that deems that hospice care is still appropriate, that's not a problem at all.
So, in these days of having to have prior authorizations for many sorts of treatment, and so you just said that they could bounce in or bounce out, basically, of hospice. How difficult is it to get an approval to put someone to hospice, and how difficult, I guess, is it to bring somebody back if they decide to roll out?
It's not difficult at all. It's a very, very easy process. Honestly, the main thing that is needed for the admission to hospice is the order from the physician, and then we need to have those physicians state that the patient is terminally ill. From there, it's us doing the paperwork and the admission process, and it's the same thing every time the patient will want to come back onto hospice if they chose to revocate for whatever reason previously. As far as insurance, it's also a pretty easy process. Most insurances do convert back to the Medicare plan at the time of hospice benefits, and so it makes it a little bit easier. If the patient doesn't have insurance either, that's fine too. We see them all the same.
Chris, what are the benefits of admitting a patient into hospice earlier rather than later?
Brad, that's a great question. And I think that that's kind of, one of the underlying large questions that everybody has about, should I or shouldn't I, that thing. I know that from a personal experience, the hospice benefit was wonderful, even though it was only 5.5 days for us. The benefit with getting somebody onto hospice sooner, there's a multiple benefits. The first and foremost is we're working with the patient and the family first to control any symptoms. Once those symptoms are controlled, that family really has a chance to work with us. We build personal relationships with them. The patient and the family, once that patient is comfortable and symptoms are well controlled, they can really work on just building those spiritual and loving relationships with their family. A lot of the times, if we get people on more hastily, kind of like in my personal experience, we spend the first day or two trying to get my grandmother, her symptoms controlled. We were able to do that, but we didn't have as long the time to build the relationships with that hospice staff or with the chaplains. And I think that, if I do it all over again, my grandmother probably would have said no, but I would have liked to get her on hospice a lot sooner than we did, knowing now what I should have known then, I guess.
How old was your grandmother?
She was 88, almost 89.
Oh, my gosh. Yep. Oh, crap, that's nuts. So how about hospital-based care? I guess let me back up a little bit. I guess I think that hospice in the home, is that like a constant visit by individuals from Mercy or other individuals involved in healthcare, as opposed to being in the hospital, where, the nurses walking up and down the hallway all the time and doctors and all that sort of thing?
Sure. So I think when everybody thinks of hospice, the majority of hospice is something what is called the routine level of care. And that benefit takes place either at the patient's home or in a community setting, such as an assisted living, a group home, a nursing facility, something like that. That is the majority of the hospice care. And those are the visits that we kind of work with the patient, family, and staff to see what's appropriate. And we come out there, sometimes nurses on a weekly basis, sometimes twice a week, sometimes 3 times a week, and sometimes daily visits. It just depends. Mm-hmm. With the hospital, the level of care that is required for that hospice benefit inside of the hospital is the highest level of care within a hospice, and you must meet a lot of the Medicare criteria to be able to qualify for that level of care. Our partnership with Cleveland Clinic Mercy Hospital does allow us to have patients admitted to the hospital under that level of care until their symptoms are controlled. And sometimes, a lot of the times when those symptoms have been stabilized, those patients can return back out to the community and kind of go back and forth as needed.
Interesting. Okay, we should probably take a second break here. You're listening to Health Matters with Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care, 7 days a week, and Mercy Primary Care, Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries, or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Out By store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off on Out By store in Louisville, next to the Medicine Center Pharmacy.
It's a winter wonderland at Studio Arts and Glass. Our annual holiday open house now through Thanksgiving. Take 20% off your entire order. Hand-blown glass ornaments, your Santas, jewelry. Come make a wreath or a glass snowflake. 20% off your entire order. See our extended holiday hours at studioartsandglass.com. Shop local this holiday season.
When you list your tag sale with Genuine Estate Services, you will experience professional sorting, researching, staging, pricing, and marketing of your cherished possessions. They have a large staff hosting your sale also, and they are very efficient. Call Eric at 330-206-0974 or log on to Genure, spelled Jenior, estateservices.com for more information.
We'd like to remind our listeners our program is also available on our podcast. You can search your favorite podcast app for Health Matters with the Medicine Center Pharmacy. Listen to our program anytime.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with Medicine Center Pharmacy. I'm Paul White. We're talking with Chris Fankhouser, Executive Director of Hospice Services at Cleveland Clinic Mercy Hospital. We have a lot more to cover this morning, so let's get back to the show.
Hey, Chris, we didn't talk about the costs of hospice care and if it's covered under most medical insurances for patient. Can you touch on that?
Absolutely. Brad, everything that is related to the terminal diagnosis that's admitting the patient into the hospice services, everything's covered at 100% under that Medicare benefit. Equipment, medications, all of the care involved.
Okay. And how does private insurance look at this?
So most insurances do convert back to Medicare, the traditional Medicare. Other private insurances have their own hospice benefit plans as far as days and things like that, but it really is almost always 100% covered.
Okay. I mean, there's a whole bunch of hospice programs out there, as I think I've seen over the years. Is that true?
Yep, it's very true.
So in Medicare, does it revert to Part A or for hospitalization, or help me here on how that functions?
So yes, the hospice benefit is covered under Medicare Part A.
Okay.
Yep.
So why would I choose hospital benefits of hospice care as opposed to a private other sort of insurance hospice program?
Most of the time, are you talking about the actual hospice benefit inside of the hospital or a hospice that's affiliated with a hospital system?
I guess one or the other or both.
Well, I will answer. I can answer both for you. So,
okay.
I kind of touched on it a little bit ago. That hospice benefit inside of the hospital is you have to meet a lot of the Medicare regulations and requirements to be able to meet that level of care and be hospitalized with the hospice benefit. Like I said, that's not many people when you look at the whole realm of hospice. So most people are out in the community. I think that the benefit of choosing a hospice that is affiliated with a hospital system is simply that if we have somebody on the routine level of care hospice in the community and their symptoms were to, be really out of control, we wouldn't be able to manage them with the medications that we have on hand. We could transition them very seamlessly over to the hospital if they would qualify for that higher level of care, get them into the hospital, get everything kind of smoothed over, get everything calmed down, and have them come back home. And it's all without a break of service.
Not so frequently anymore, but some time ago we used to hear a lot of myths about hospice care.
There's still a lot of myths, Paul. I actually, some of the most frequently misunderstood myths that, hospice care is only for those people that are giving up. That's one of the myths that we hear a lot of the time. In reality, it's the complete opposite. Hospice is the most compassionate, comforting, and emotionally encouraging form of health care that's out there for people with life-threatening diseases and illnesses. It's about helping the patients live their life to their fullest for whatever time that they have left, with being comfortable and surrounding my loved ones. Another myth that we very frequently see is that hospice, and I kind of covered this too with my own case, my grandmother, that hospice is only available, or it should only be for people with a few days or weeks left to live. Hospice certainly does help patients in those situations, as it did with my family, but the fullest benefit does occur when the pain and symptoms are well managed, as I mentioned before, and the patients and their families then have all of that time to really make those personal and spiritual connections with one another. Go ahead.
I'm sorry. You're up still. Go ahead.
Oh, no, that's fine. I think that the final myth that is the most bothersome is that hospice care ends when the patient passes away. And in fact, that's not true. Bereavement, or grief support, it's a very, very vital part of hospice. We do have our bereavement coordinator does work with families during the time that the patient is on hospice and looking at that anticipatory grief. But here at Mercy, we do follow families for 13 months after the patient and the loved one passes away to make sure that the family is doing all right.
So, in this healthcare environment that we're living in right now, I would suspect that hospice patients are separated from either the normal in and out hospital patients or the nursing home hospital individuals. Is that pretty true?
It kind of varies, yes. I would say, at the hospital, most of our hospice patients, again, they could be anywhere within the hospital, but we do try to have them all kind of on one floor together. Within nursing facilities, honestly, it's kind of all over the place. And I don't mean that in a bad way. I mean that in a good way. If we have a young lady or a gentleman that's been in that nursing facility for several years and that room has been his home for 2 years, we're certainly not expecting the family to move him just because he's on hospice. So, if a patient is admitted into a nursing facility and signs up to hospice right away, they get the room that the family picks and we, sign up with hospice and we're there. But I wouldn't say that they're really grouped together. And the wonderful thing now in today's day and age with everything that's going on with the pandemic is more and more places are far more educated on, how to just be proactive and remain healthy. And visiting restrictions are becoming fewer and far between now.
Okay. So what about food? I mean, special diets and all that. Is hospice, do they accommodate all this in the home as well as in the hospital or institutions?
Well, the one benefit with hospice is patients can absolutely eat or drink anything that they want. It's all for pleasure. Anything that their family wants, anything that they like. As far as hospice services in general, we don't provide the food. The food is, part of what the family or the patient likes to have at home. But we kind of say that there's not really it's all for pleasure. There's not really a lot of rules when it comes to diet restrictions. Folks that are not on hospice that may have a diet restriction such as they require thickened liquids, or maybe their food needs to be modified and be ground up and be softer, or maybe they're following a low-salt diet, those types of things. When somebody signs on to hospice, it's up to them whether or not they want to continue to follow those regulations. We certainly don't say yes or no, they have to, and it's all about pleasure and what's comfortable to them.
I thought it was interesting. My father-in-law was in an assisted living and also the other portion of the home. And when he was living at home, he was used to having a shot of whiskey, in the afternoon. So I thought, what are we going to do about this? Well, the doctor authorized it. Have a shot of whiskey, in the afternoon. So, hey, how good is that? Okay. So.
Wonderful.
That's neat. Okay, so this is also National Caregiver Month. What type of physical and emotion toll is caused by caring for a loved one also?
And Paul, that's a great question also. There are so many caregivers that do become easily fatigued and stressed. We definitely think it's very important for the caregivers to take care of themselves. And a lot of the hospice benefit is our education to them on how to make things easier while they're caring for a loved one. We sometimes see family members put everything that they have into caring for a loved one, and then at times they forget about themselves. I think we kind of did that again with our own family, and we had to remind ourselves to take care of ourselves, go out and enjoy, family walks and just get out of the house for a little bit to really regroup and get some fresh air. Sometimes, like I said, it's simple as taking a walk like we did, and sometimes it's just, having the family members or friends that are taking care of the patients go out and meet up with friends and family, have a dinner to just really rejuvenate the caregivers.
So, what are some common family caregiver issues that come up?
Caregiver burnout is one of them, and it can certainly happen to anybody, especially when there's not enough time that the caregiver takes to give to themselves. Often with larger families, each family member can kind of take shifts per se, and a lot of times with larger families too, each family member can be at a different stage of acceptance with what's going on with the loved one's disease and the progression of that disease. Our nurses and aides can definitely help ease the burden of the patient by coming out to the home more frequently, providing showers if the family doesn't feel comfortable showering the patient. Our social workers and chaplains are a huge support for them with the families, friends with emotional and spiritual needs as well.
Is there an average time that someone is in hospice, or is that statistic not carried?
No, it is. It's the length of stay does vary. I think it's probably around 20 to 30 days, about 30 days right now. Of course, we do have a lot of folks that are on hospice services for a week. That we also have people that are on hospice services for well over a year.
Okay. We should probably take our final break here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. Do you have to blood test because you have diabetes? Is the price of the test strips nearly have you in the poorhouse? At the Medicine Center Pharmacies, we give you, at no charge, a complete test kit with strips as a starter. Then when you purchase more strips, expect a cost savings price of $7.99 for 50. A huge savings over many brand-name test strips. So stop in any Medicine Center pharmacy in Canton, Louisville, Minerva, and New Philadelphia for info. Also, we have curbside service, drive-through windows, and free delivery service. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. When you list your tag sale with Genuine Estate Services, you will experience professional sorting, researching, staging, pricing, and marketing of your cherished possessions. They have a large staff hosting your sale also, and they are very efficient. Call Eric at 330-206-0974 or log on to Genior, spelled Jenior, estateservices.com for more information.
We'd like to remind our listeners our program is also available on our podcast. You can search your favorite podcast app for Health Matters with the Medicine Center Pharmacy. Listen to our program anytime.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
We are back with Health Matters. This is our final segment, so let's get back to the show.
Okay, let's talk about the types of services that Mercy Hospice provides for support or bereavement programs for caregivers.
Oh, absolutely. Mercy Hospice not only works with the families, as I mentioned before, with that anticipatory grief, but the individualized bereavement support is also provided for the 13 months following the death of the family member and the death of the patient. We offer support groups with various times and locations throughout the month on a regular basis. Some families, there's a lot of, bereavement support that's needed, and some families there isn't. It's, again, all on an individualized basis.
What about, are there caregiver resources that are out in the community?
Yes, there are, and our social workers do a great job along with our bereavement coordinator and our chaplains. They all do a great job working with the family members and getting them in touch with some of those different areas.
How do you utilize volunteers at Mercy Hospice, and what roles do they serve?
That's a great question, and that's a lot of I guess, a question that people don't understand the answer to. Since hospice was founded 100% on a volunteer basis back in the day by Cicely Saunders, today it's actually a regulation that 5% of the total direct hours must be from volunteers. So our volunteers can be utilized in any different realm that they're comfortable in. A lot of them sit bedside along with patients just for visitation, play music, prayer support, that type of thing. A lot of the volunteers will work alongside us in the office and do a lot of the clerical processes in the office. And it's just a beautiful, beautiful relationship with all of them.
I can see how that'd be very valuable to help bring a different dynamic to the hospice care program if you could have some of those volunteers that have special skills, like you said, music or whatnot. That's a nice touch. So
I used to see, I haven't been in the hospital, in a long time, but I used to see gray ladies, candy stripers, as volunteers.
Uh-huh.
And I don't even know, does that exist anymore in the hospital?
I haven't seen, candy stripers. I haven't seen those in a long time, Paul.
Well, I'm old, okay, or older. But I remember the gray ladies, too. And I remember at Mercy, years ago, they had gray outfits on and all that sort of thing. And they were sort of volunteers. That's before your time, right?
A little bit, yeah.
Okay. Well, anyway, what is in the hospitals now? Is there a volunteer cadre of individuals, or is that not allowed right now with the way things are?
A lot of it it depends. A lot of it is not allowed right now. A lot of nursing facilities also don't want a lot of volunteers to come into their buildings right now. So we're doing a lot more virtual visits, if anything, right now to make, the contact with the patients and the families. I think that volunteering, no, not just for hospice, but volunteering is such a huge part of giving back to the community that I think a lot of more and more retired folks are looking at volunteering, and I think it's a great thing.
So if someone's compelled to volunteer for hospice, what do they need to do?
It's a really easy process. If anyone is interested in volunteering, please reach out to our volunteer coordinator. Her name is Donna Indivina, and she actually had the wonderful opportunity early in her career to train with Dame Cicely Saunders over in London. So she actually got to meet her and train with her. It was wonderful. But as far as what's actually needed to be a volunteer, fingerprints and a background check is required, but it's absolutely very simple to become a volunteer. We would always love to have additional volunteers. A lot of the times we will see family members of, previous patients who have passed away in our services return to volunteer their time to kind of help the next family through the hospice journey as they were helped.
Well, what all can volunteers do, in this environment?
Honestly, Paul, anything that they want. There's some volunteers that wish to make phone calls to check in on patients. There's some volunteers that would like to make bereavement calls for some of the folks who are on the bereavement program. A lot of the volunteers do want to have direct patient care, so they're able to sit vigil with them bedside. They're able to provide companionship. If some of the volunteers, if they have a specialization, like, mentioned earlier with music, we had a harpist at one time that was able to play the harp for some patients. Some people, volunteers, have pets that are certified and will, come visit with pets. And there's other volunteers that really don't want to have a whole lot of patient contact, but they do want to help in the office. So we have those people come here all of the time to help with decorations. So we have volunteers that make our quilts. We have volunteers that come in and do a lot of our filing for us. Anything that they want to do, we can definitely make a place for them.
So will you decorate their home for Christmas?
We can.
Okay. I just think of it. Some people, particularly older folks, I'm not going to put a tree up anymore. And, just too much trouble and, all that kind of stuff. And even a lot of younger people, too. And in fact, I was just talking to somebody yesterday, and I said, what do you mean? I said, you're a young person, and why aren't you going to get the spirit a little bit anyway? Don't have any children anymore. And I would think that would be one of the really special things for a hospice patient, be a small tree or something like that.
Absolutely. And our entire team loves doing that too. So a lot of the times, the nurses and the aides, especially because they're out in the homes more frequently, will help with decorating and setting up Christmas trees to help the families that can't do that.
Okay, so let's say I'm a hospice patient, okay, and I don't really require a lot of attention or a lot of care. Do you still have a regular visitation schedule for somebody like that?
Absolutely. It's completely up to you and your family. A lot of, the nursing visits are based on the medical need. As you said, if you don't require a whole lot, maybe we come out once a week, and maybe our aides come out once or twice a week and just help with companionship, that type of thing. We also have the aides come out with not so much you, Paul, but the ladies will come out and, do their hair or fingernails. There's a lot of times we've actually had our staff go out on the weekend and help get the patient ready for a family wedding that's going on. And those types.
You mean I can't get a haircut or anything like that?
We could try, but I don't know if the hairstyle might be a little bit out of whack there.
Okay. It still grows. Hey, listen, we're really short on time, so I really appreciate you coming on today. And we learned a lot, and hospice is really amazing. People years and years ago just died. And, maybe the family wasn't even around or whatever. And I'm sure the family is always encouraged to be around and frequently in a hospice environment. So,
can you leave your contact information, Chris, for the listeners so they can get in touch or get more information?
Sure, Brad. Yes. Anybody who is interested in volunteering or would just like any additional services or information about the hospice services, please call our office. Our number is area code 234-203-3223.
We got to rock it through. We're out of time, okay? Thank you very much. Thank you very much, Chris Fankhouser, DPT, Executive Director of Hospice Services at Cleveland Clinic Mercy Hospital. And we'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Cleveland Clinic Mercy Hospital, Studio Arts and Glass, January Appraisals and Liquidations, and, of course, our technical producer, J.D. DeAngelis. As always, we thank you, our listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again right here next Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.